With cholangiocarcinoma being such a rare cancer, not many people know about it. We need to get the word out there.
World Cholangiocarcinoma Day offers an opportunity to centralise the attention on this disease. It provides a pathway for the people with lived experience, the community, the medical professionals, healthcare, all to come together around this particular disease and look for how it can be addressed in their community.
Cholangiocarcinoma is one of the biliary tract tumor subtypes. Is created or is arising from the cells that are creating the bile ducts. It can be divided between intrahepatic, hilar, and distal cholangiocarcinoma depending on the anatomic location. The diagnosis is usually something that happens quite late, unfortunately, when the tumor is usually in advanced stages, and this is because the symptoms are quite inspecific. Most of the times, the patients will present with jaundice or with abdominal pain, and we will perform some imaging like a CT scan or an MRI, and we will identify the tumor or the mass in the bile duct.
My signs and symptoms of the disease, cholangiocarcinoma, began when I was cycling one Saturday morning, where I had a sudden onset of fatigue. And then my eyes started to yellow, my hands began to itch, and a little bit later on, I noticed I had clay stools. When you get diagnosed, your life goes into a spin. You get sucked into a void. Your life changes at that moment, you just don't realise it.
I think when we see patients in our clinic, it's really important that we explain the reason why the molecular profiling is so important for cholangiocarcinoma. Unless we perform the testing, we will never be able to allocate the patient to the right treatment. Some of the very big changes that we have had in treatment of cholangiocarcinoma has been the development of targeted therapies and also the incorporation of immunotherapy. Looking into the future, I think we will have more and more options of targeted therapy also combined with immunotherapy, which is of very much interest. Clinical trials are of very much importance for cholangiocarcinoma and in cancer in general because are the way of us testing new treatments and also comparing the new treatments with our standard practice so we can identify which are the best treatment options for our patients in the coming future.
Well, initially I didn't even know what a clinical trial was, but I was fortunate to be in the care of an oncologist who was leading a clinical trial and had looked at my profile and saw that I had an opportunity to fit into a trial that he was running.
The clinical trials that are coming out do offer that extra hope of survival.
Cholangiocarcinoma is an aggressive disease, so you have to understand that it's aggressive and you have to be prepared to make tough decisions and make them fairly quickly because it's not a disease that waits for you to consider. You always have to look to the next step, focus on that and do it well, do it the best you can. Don't worry about the whole challenge. And I was fortunate, my life improved. I overcame the diagnosis and it's been a slow journey from that point to get back to what you call normal life.
I would suggest to other caregivers that they accept any help they can that's offered from friends and family. It is a big role being a caregiver. It's very demanding, though the help that's offered is invaluable so that you get that time out as a caregiver and then you can recharge and be the best caregiver that you possibly can for the patient. I feel that with the SHAPE program, it's a great opportunity to show that there are people out there who do care. They do want people to get as much information as they can. And I'm really thrilled to be part of this program.
To my eyes, the value of the SHAPE programs is really putting together healthcare professionals and patients in creating the content that will allow patients to understand better what is happening.